It doesn't take long to become addicted to opioids. In fact, 10 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%, and we've opened 4 outpatient addiction treatment centers across the state to help patients recover from addiction. Learn more at geisinger.org/recovery.
Additional support provided by the Commonwealth of Pennsylvania and viewers like you. Thank you.
This year, overdose deaths have risen an average of 13% across the country compared to 2019. The New York Times has referred to the COVID-19 pandemic as a national relapse trigger. If this trend continues, it will be the sharpest increase in overdose deaths since 2016. Hello, I'm Paula Giangiacomo. Tonight, Pennsylvania PBS presents our 6th collaborative program in which we'll provide helpful information for those who are dealing with addiction. For some, it's been a very long road, especially in dealing with the COVID-19 outbreak. We'll find out tonight how those in recovery are dealing with the pandemic. If you know someone who is struggling from addiction, call 1-800-662-HELP or visit battlingopioids.org. Across Pennsylvania, thousands of people depend on rehab counselors and other social service professionals to keep their recovery on track. The restrictions of the coronavirus pandemic have interrupted the usual in-person connections, but that doesn't mean the work has stopped. Let's learn how care navigators in Washington County are finding new ways to keep their clients on the path to recovery.
I taught myself how to play guitar at 9 years old. It helps bring that calmness over me, especially in the midst of a pandemic. It's the one thing that is there and just stands true. It just calms me in the meat of the storm. I'm Joey Pagano. I'm a care navigator for the Center of Excellence. We link a client to the pertinent services that they will need to have a successful recovery. We help warm hand hold through their recovery, and we don't let go until they have a healthy recovery. I met Sarah when she was trying to get clean. She became a client.
My name is Sarah McMahon. At the beginning of the pandemic, I was out running and ripping and getting high and doing stupid stuff. Then I overdosed in my mom and dad's bathroom. I woke up to a paramedic and a police officer standing over top of me, and my pants around my ankles, and I was taken to Washington Hospital. When I was in rehab, I heard that there were people that might have COVID, and I had called my husband and told him, "You need to get me out of this place." He ended up calling Joe, and Joe was like, "Don't go pick her up." Had my husband came and picked me up from rehab, I probably would have overdosed and died. I would have been back out on the streets within a week of me being home. Even when I got out of rehab, I still had another month and a half where we were quarantined. It was kind of like being in rehab after I got home because I couldn't really go anywhere anyway.
Before the pandemic, we had face-to-face contacts. Now we have all these barriers. We learned telehealth. It was something that was, I believe, is the blessing in the storm. I'm still able to hold your hand through the whole process, even though it's through Zoom. Even if it's through teleconferencing, we're still able to just connect.
Hey, so it's definitely a good day out. What do you have planned today?
When I couldn't see him in person, we would do teleconferences or Zoom, and we would kind of just work through things like set goals. At first, it did feel a little weird, but you got used to it after like a week, and then it was like, well, this is really cool because I live in Pennsylvania, but I'm going to a meeting that's in Florida.
How are you doing?
I had fun doing it.
Did you?
Telehealth is something that I can't see going away. It literally saves lives. It's an extension of treatment that I've never seen before, where we could reach someone without even getting in their house, but yet we're getting in their heart. What a day, you know?
So good.
It did. I'm an essential worker, and I was placed in this position for a reason, to help people, show them empathy, teach them compassion.
Now I'm 4 months and 12 days clean, and I'm finally starting to look at my life differently. I'm finally starting to love myself and not hate me as much. And if the anxiety does spike and I do start to freak out a little bit, I know I can call Joe.
Truly, the pandemic, it didn't hurt us. It made us stop for a second. We regrouped, and we were able to just connect with someone just in a different way, an extension of love, because it's all about love. Pandemic just did not change that.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.
In Washington County, Sarah is just one of the 50 clients who each care navigator is counseling virtually during the COVID-19 pandemic. Now it's time to meet our panelists. Senator Jean Yaw represents the 23rd Senatorial District and is the chairman of the Center for Rural Pennsylvania. Welcome, Senator.
Thank you. Great to be here.
And Raphael Bereshansky. He is the Deputy Secretary for Health Preparedness and Community Protection at the Pennsylvania Department of Health. Thank you for joining us.
Thank you for having me. A pleasure to be here.
Recently, Governor Wolf signed the 11th renewal of the Opioid Disaster Declaration to continue work to aid in the opioid epidemic. How will it help during this health crisis?
So first, I'd like to thank Governor Wolf. I think the signing or the re-signing of this disaster declaration really shows Governor Wolf's commitment to Pennsylvanians who are afflicted with the disease of addiction. We're really making moves to address the opioid crisis, and we work with our federal, state, and local partners. I think that as we look toward the future and we look toward the COVID realities, we see that there are issues. We had a shelter-in-place order and a stay-at-home order, and those have created difficult situations for individuals with substance use disorder. Governor Wolf re-signing the disaster declaration is just one step in regard to addressing that.
So what exactly, Ray, does this disaster declaration, what will it do to help the opioid epidemic?
It keeps our opioid efforts going. Every week, multiple state agencies meet at the Opioid Command Center, headquartered at the Pennsylvania Emergency Management Agency building. And we hear about various initiatives that are going on in regard to treatment, response, and other areas of our overall response, our statewide response to the opioid crisis. We've done that since early 2018 when Governor Wolf signed the first disaster declaration, and those efforts continue.
Senator Yaw, how difficult has it been during this COVID-19 pandemic for people who are struggling with the opioid epidemic, especially in rural areas?
I mean, it's just emphasized all the problems in rural areas. I mean, whether it's distance or whatever. One of the things that we've mentioned, in the past, warm handoff is critical. Well, warm handoffs just frankly, mostly don't occur anymore because of the limited access to emergency rooms, which is where a lot of those types of things happen.
And just to recap, warm handoff is when someone in recovery ends up in the ER, they are introduced to a counselor to help them.
Someone, hopefully it's a certified recovery specialist who can identify with them and talk to them and at least maybe get them in a program. That stopped. Even I know telemedicine has been an issue. That's an issue in rural Pennsylvania. Now, the one thing that COVID-19 has brought to the forefront is the importance of rural broadband, because everybody's worried about or concentrating on schools opening and everything. But telemedicine and access to counseling through broadband is critical. And unfortunately, we don't have it. We're now depending more and more dependent on it. So those are just a couple of things that have really, I think, impacted the whole opioid heroin issue.
Mm-hmm. Back to the governor's signing of the 11th disaster declaration. Some of the suggestions in that include continuing the prescription drug monitoring program. How do you feel that program is working, especially now during this pandemic? Is it effective?
I don't think that there's any question about that it's worked, and we've got to watch how the number of prescriptions that are going out the door, and I think that's really helped control that part of it. I know that the interesting thing is the AMA guidelines have kind of taken a different step, and they want to make prescriptions longer, maybe even a 90-day prescription. I've read some of those articles, and that's more about how the insurance handles co-pays than anything else. And I still think that what we've done in Pennsylvania is really the way to go, and that is to we need to limit the number of opioids that people get right off the bat, so that we don't have to worry about them becoming addicted.
On our next segment, we'll take a look at how coronavirus is affecting all aspects of life. For someone dealing with addiction, the change in routine could be detrimental to their recovery due to isolation and increased anxiety. For some, facing two public health crises at once, the challenges are great.
I had a helicopter mother, so I'm very close with my mom today, but she was always on top of me. And I quickly chose the art of baton twirling at the age of 12. And I ended up going to college at the University of Miami. And I was the featured twirler in Miami and quickly got introduced, after being very sheltered, to a lot of different things in college, from the Quaaludes to the other types of things and alcohol. I'm going to fast forward because this is where my story comes into opioids. I ended up seriously hurting my back. I ended up having 2 spinal surgeries. And quickly, because of the addictive personality and the disease of addiction, and I was given opioids. It didn't matter whether it was Tylenol with codeine, Percocet, Vicodin. I would take it, and I would probably take 3 or 4 more of what I was supposed to take, because I was a physician's wife. Instead of getting 50 pills, I got 100. So I basically took them the way I wanted to.
COVID-19 and the pandemic have really thrown a wrench into the entire works.
It's not the same because, if you're already started to be in isolation mode, it's easy to kind of just put the phone down and not pick that up. No one's really calling you out on it. If you're at a meeting, someone can see you and see if you're struggling or if you need help. Or where were you yesterday? And it's just different. So I could see where people can get lost in that.
People are spending a lot more time inside. There is a certain reluctance to call for help. And what we've seen anecdotally are numbers of fatal overdoses going up a little bit. This is a trend, that we're looking at extremely carefully. And several of our areas here at the Department of Health, both our Bureau of Emergency Medical Services, which tracks ambulance data, as well as our prescription drug monitoring program, or the PDMP, are looking at these trends very carefully. The pandemic's really impacting a lot of face-to-face of what we've tried to do up until this point. Sometimes it includes the actual naloxone or Narcan being given out. And so this is really turning into a very difficult situation in regard to our disaster declaration about opioids.
I can identify with people in recovery. That's why I'm in it, from all walks of life, from different types of addictions. It's always the same thing, it just got worse and spiraled out of control. I know someone personally, he's a veteran of the Army. He overdosed. He's from this town of Palmerton. He left a daughter behind, and he had a few years of recovery time. He was doing really well, and I don't think it's a coincidence that it happened during this time.
Our parking lot is empty. I do feel that there's people who are not seeking services right now who need services.
I need to stay connected during these crazy times.
They're having meetings in like parking lots instead of in the church.
Carbon-Monroe-Pike Drug and Alcohol Commission is the single county authority for Carbon, Monroe, and Pike counties. And with that, we work with the Department of Drug and Alcohol programs to help provide funding and access to treatment for uninsured individuals. We also, in Carbon and Pike County, have functional treatment units where we provide outpatient, intensive outpatient, and assessment services. I think our overdoses are looking at, probably, increasing, in my opinion, as we continue to move forward. People are still becoming more desperate, having more mental health problems, and everything gets tied together, and people making choices that could lead to that behavior.
One of the initiatives that one of our sister agencies, the Department of Drug and Alcohol Programs, or DDAP, has been involved in is their Get Help Now hotline. And it's 1-800-662-HELP. There are always operators there, and they have received to date tens of thousands of calls. And thousands of those have been specific to getting directly into recovery.
Getting into the pandemic, I couldn't imagine not being sober going through this. So, being a sober mom and a sober wife is a gift. I wouldn't trade it for anything.
Recovery is possible and treatment works. We want people to know we're there. This is important to us. You are important to us.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.
As we have just seen, isolation and change in routine are major factors for those dealing with addiction during COVID-19. Now let's meet Jordan Barber, Director of Clinical Operations for Psychiatry and Addiction Medicine at Geisinger. Welcome, Jordan. Thank you for joining us.
Thanks so much for having me, Paula.
How do you help people, especially during this pandemic, get to that end point, that success?
Yeah, I think a lot of it, Paula, has to do with hope. We hear and see so much negativity and frustration that those success stories are incredibly important to hold up and to share and to continue sharing. And Senator Yaw mentioned earlier the importance of certified recovery specialists, CRSs. That's part of their role, is to bring that hope forward. And folks that might be embattled and struggling with addiction right now, showing them that path forward to recovery and what that looks like and how to get there.
While healthcare providers are offering telehealth video calls with physicians, sobriety programs are hosting meetings and counseling sessions virtually. Can you explain the advantages of virtual counseling?
Yeah, absolutely. I think virtual anything in healthcare has really been thrown into the spotlight with the coronavirus, whether it's a physician visit or a counselor visit. What we've seen at Geisinger is that the pros have to do with engaging patients. We have seen our no-show rate drop in the behavioral health world from around 20% to less than 10%, which is terrific. It means that more patients are getting the care that they need. A lot of that has to do with transportation, right? So public transportation and other means have been shut down over the period of time we've been responding to the coronavirus. So people have struggled to get to appointments. They have childcare challenges. They have family care challenges. And so getting, even if it's just a couple hours to an in-person appointment can be incredibly challenging. And to be able to do that from the comfort and convenience of your own home is tremendous. Some of the downsides, if you will, have to do with parts of healthcare that just have to happen in person. So physical examinations, in the case of substance use disorders, urine toxicology lab testing is much easier to complete when you're in person. So at least at Geisinger, we've tried to strike a balance between those pros and cons, and we've had both telemedicine and in-person visits throughout the course of the virus.
Jordan, the New York Times has referred to the COVID-19 pandemic as a national relapse trigger. Have you seen that with your patients?
Absolutely, and we hear it through our network of contacts. We've been participating with other treatment providers across the state and trying to figure out what's going on, right? There was a lot of uncertainty and lack of clarity into what was happening in the past 5 to 6 months with the community that's struggling with addiction. And so we've seen that isolation in particular, I think Senator Yaw mentioned it earlier, is a key driver. Patients were telling us that they hadn't left their house in many, many days. Many of the in-person recovery supports, 12-step meetings, different recovery groups ceased their in-person operations, and there was some disruption there. Folks that had relied on that for their sobriety, there was some disruption, as well as traditional treatment modalities. There's been disruption, so it's absolutely a trigger. You throw into the mix the stressors on the social determinants of health, economic stressors for those that may have lost their job. I mentioned transportation, housing, all of those things have to do with an individual's strength and recovery, and disruption to those components of life can have a severe impact on an individual's well-being.
Impactful indeed. Thank you, Jordan Barber. We appreciate you joining us on this program. Now we'll welcome back Senator Gene Yaw and Ray Bereshansky, Deputy Secretary for Health Preparedness and Community Protection at the Pennsylvania Department of Health. Gentlemen, we discussed how the governor of Pennsylvania issued his 11th disaster declaration for the opioid epidemic. And Senator Yaw, you mentioned that the state of Pennsylvania is not doing enough to help people who are suffering from this opioid epidemic, from substance abuse disorder. Why do you say that?
No, I think that the state is doing an outstanding job, and the declarations and everything. What I said, it does not get, I guess, unfortunately, the media attention. It is not something that is on everybody's mind anymore. It has been replaced. If you turn on a newscast today or turn it on right now, I guarantee you that there will be a news program about coronavirus. Do we see anything about an opioid heroin crisis? The answer is no. That issue has never gotten the media's attention other than the programs like this. It has just never registered. And I've often asked the question, why? Why hasn't that registered? No, I think that the state has done, we've made naloxone available, we've done the emergency declarations, we've done changes in the law. We have really responded, but it just has not registered out there, and that's my question. Why hasn't it registered with the general public?
Ray, what's your response?
Well, first, I just want to thank Senator Yaw for his kind words regarding the overall state effort. We appreciate it. Thank you. Secondarily, your comments about naloxone, the prescription drug monitoring program, even the emergency declarations, these are all elements of what the state is trying to do to take care of that exact issue, the issue of understanding, the issue of stigma, the issue of the public paying attention to this. And what you just mentioned is something we collectively, the state agencies that meet weekly in regard to this disaster declaration, grapple with as well. Even me being on programs like this, which Senator, I think it's the third time you and I have been on this panel, please correct me if I'm wrong, it may be the fourth, that's bringing attention to the issue, but it has to be consistent. We have to keep bringing attention to this issue, shining a light on this issue, and making stigma go away.
Other than programs like this, Ray, how else do you think the state can shine a light on the opioid epidemic? Because obviously it's still prevalent.
You're correct, it is. We've pushed out messages on programs like this. We've utilized social media. The governor has even mentioned it himself. You are correct. It takes a multifaceted campaign to even begin to address this. I discuss the overdose crisis in Pennsylvania every time I can with the various audiences that I address. But I don't think any public entity, any private entity, or even any academic entity is going to be able to handle it on their own. It's that coordination of efforts that's going to begin to get it done.
And we should mention that your website, the state's website, it has a lot of resources.
It certainly does. And thank you for mentioning that as well. I probably would have gotten in trouble for not mentioning it. The website has a ton of resources, and we're consistently pushing out messaging specific to our emergency declarations and specific to the various resources, including where to get naloxone.
COVID-19 pandemic has been a time of uncertainty for everyone. Many are dealing with new challenges. But for those in recovery, this time has been even more challenging. Here's a look at a day in the life of someone trying to maintain their recovery during COVID-19 while also working remotely and parenting young children.
My name is Samantha Osterloff, and I am a person in long-term recovery. And what that means for me is that I haven't had to use a drink or a drug since December 21st of 2011. I was actively using for between 8 and 10 years. My daughter was 3 months old, and I overdosed on my parents' couch. My arresting officer at that time said it was December 20th. And he said, "Merry Christmas. Your current probation officer said you can go to treatment and not jail." And that really is what, for me, started that ripple effect of the change in my life that I would attribute to where I'm at today. Over the last almost 9 years, for me, it has really been about completely rebuilding my life. I just bought my first house in January. I have a bachelor's degree. I graduated with honors. I have a graduate degree. I graduated with honors. I'm part of the National Honor Society. I'm an adjunct professor at London Valley College. I teach at Berks Tech. I do trainings for police and parole. I have my daughter has, as far as she remembers, she's never seen me under the influence of drugs and alcohol. I married my husband, and we kind of built this, beautiful little family. I had a son 4 years ago last week. I was worried for myself personally, for my mental well-being. And that's being transparent and honest. Because to go from working full-time and teaching and having your kids in daycare or school to working full-time and teaching from home with your kids home, not knowing how long that's going to be your normal, is really scary. I am here starting my morning. My son's joining us. He's got Spider-Man. My daughter's still sleeping. This is certainly a morning in the life of somebody in recovery. The first couple weeks of the, self-quarantine were difficult. I think that as we're continuing to have to be inside as people in recovery, we're becoming very resourceful. And just being more honest about asking for help. And I'm trying to work full time, maintain my recovery, maintain my sanity, be a mother, homeschool my kids, get their work done so they don't fall behind.
and just kind of manage through the day. I have a couple of my girls in my women's support group that we have like a group text. We're using this app called Marco Polo, or we can send each other video messages. So really, I'm just trying to connect to every outlet I possibly can to stay connected. And so something I've been, really thinking about today is to continue to do everything in love, and most importantly, right now, like love myself, to not have high expectations on myself that, if we go to bed and there's some dishes in the sink, it's okay. We had a long day. We're trying the best we can. We are fresh off of a typical quarantine meltdown situation. Chloe's brother broke her doll bed. Luckily, we have our family supports in place, so nothing that a FaceTime from Grampy can't fix, right, Chloe? So there we are. It's a little insight into our day. We're trying to not have any more meltdowns today. So here I am with my last vlog.
And I said we're in bed.
We're in bed, as my son says. It's been a full day of
and I saw a bug.
He saw a bug.
And a skunk.
This is a day in the life.
And I also a skunk.
Today was a rough day. A lot of meltdowns, a lot of struggles. I was very powerless and many times today. But I reached out and I got support, and I made it another day. One day at a time. Very one day at a time these days. I say a prayer and I go to bed. And I wake up and hopefully, I do it all again tomorrow. I think it's a great idea that we keep doing these so we can look back and maybe we can look back after the pandemic's over and coronavirus is gone and really be able to see our resiliency and our strength, because that's what I'm seeing now, resiliency and strength. It has been about 4 months since I first checked in with the video blog, and looking back on my old videos, I think that the circumstances haven't necessarily changed, right? We're still in a time of a lot of unknown, and so I think I've come to a greater level of acceptance in that real lack of power in knowing, what's going to happen. And we're just going to keep trugging along one day at a time, as we did before.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.
Our next guest is Steve French from Recovery Bank in Lackawanna County. The Recovery Bank is a peer-driven recovery support center for persons who have experienced addiction to alcohol or drugs and their loved ones. Welcome to the program, Steve.
Thank you very much. Happy to be here.
Steve, what does the Recovery Bank do?
It's, as you described it, it's for people who are attempting to live a life of recovery. We are peer-driven, which means myself and everyone who works there has a history of substance use disorder and are living in recovery and can then kind of guide and mentor if we need to. Some people would say a coach, but we walk with them too. I mean, we help them in any aspect that would help them, and we try to remove barriers or make sure we address them.
As we saw in the video before you, some social distancing measures make it much more difficult for people to maintain their mental health, especially people who are in recovery, because being isolated from others can trigger feelings of loneliness, stress, depression, and anxiety. What information or tips do you have for people struggling with addiction, especially during this pandemic?
Yes. Well, as you said, I mean, isolation is deadly. It's a big part of the problem, and it will get in the way of the solution. What I would recommend, to the extent possible, but as the senator said, not always possible. Zoom has been excellent. Every meeting that I know of has offered Zoom at some point. Some are coming back live, but there's also a lot of resources for connecting on like YouTube. There's also websites that you can chat in. That's not it's not live. It's not optimal, but it's something, and it's some support.
And do you find that the people who you're dealing with who are in recovery, do they find that helpful?
It's a mixed bag. Everything is a mixed bag. Some people are pleasantly surprised. Some Zoom meetings now, we have people that would never be able to come live. And, you can hear a speaker from California, and it's interesting. But as far as Zoom goes to the detriment, some people can't even access Zoom. They can't download the app. Their phone doesn't support it. As the senator said, they don't have access to the internet. So, and that's not the only thing, but if you don't have access to the internet, then there goes my suggestion to go on YouTube or, do search in general on the internet. There has to be a baseline access point, but that's what I would say about that.
Well, for Samantha Osterloff, who we featured in the video, she said group text actually helped her. Do you think that's helpful? At least you can communicate with people over text messages, even though you may not be able to see them. It's better than nothing, right?
Sure, and in my field, I'm a certified recovery specialist, so there are, we are a true peer. Most of us have a cell phone, and our clients or our patients have our cell phone number. So in addition to a group text, which I would endorse, you can also usually have that kind of communication, that kind of connection, at least keep that going. And it really is. That's, I think, underutilized and maybe underappreciated.
Steve, if social distancing contributes to the opioid epidemic, what tips are there for people who can't obviously be social? I mean, ways to reduce stress or ways to connect with people or maybe ways to increase physical activity. What other kinds of things can people do to cope during this pandemic?
Yes, there's meditation is something you can do, and that's a solo act. Sometimes it's guided, but it's usually a solo act, and that can help on a daily basis, can help keep a person in a better balance. And the rest of the stuff that might be able to help, like yoga and physical exercise, that kind of stuff is tremendous. And again, it's something a person can do. Will take up some time and be of real value. I run, and that gives me a lot of peace of mind. I find that on a daily basis, if I run or even walk, it's very helpful.
Yes, exercise does release endorphins. So if people need help, can they contact the Recovery Bank and perhaps talk to someone like you?
Yes, the Recovery Bank is in downtown Scranton, and I do want to add, it's a community center. So it's a community center. So as that, there's also one in Wilkes-Barre called New Roots, and there's one called Trehab, Wyoming County Way, Tunkhannock. So those are all excellent. I mean, you can call, it's not recommended just stop by the Recovery Bank at this moment, but the other two are, you just walk right in, you'll have a peer, you'll have some sense of connection, and to the extent possible, you'll have people who will help you every step of the way, and that would be a real cure for isolation. That's what we're there for. We're there to connect and connect to these people who need connection.
Great. Thank you, Steve. Thank you for coming on this program. We appreciate it, and good luck with your recovery.
Thank you very much.
Let's welcome back Senator Gene Yaw and Ray Barashansky, Deputy Secretary for Health Preparedness and Community Protection at the Pennsylvania Department of Health. We talked about telehealth a little bit, and in some areas, especially rural areas, Senator, that's difficult. What can be done to improve that?
That's a very good question, and it's permeated everything we've talked about here today. The Center for Rural Pennsylvania, we've done extensive studies on the necessity of broadband in rural Pennsylvania, high-speed internet, and what the COVID-19 has brought to the surface is the importance of broadband, not only but with education and everything, and of course the importance of being able to access a counselor when you need one. And in rural Pennsylvania, we don't have that capability.
Internet access is
we don't have the high-speed internet access. And the Center for Rural Pennsylvania has done numerous studies on it. We pointed out some of the errors with even the FCC information. So we're working on it. And there are a couple of programs going on in not necessarily in my district, but in rural Pennsylvania, which I think will be pilot programs throughout the state as far as how to get high-speed internet out there. But it's critical. Every piece of our life, I mean, whether we're talking about drug addiction, we're talking about regular telemedicine, whether we're talking about businesses, farming, or whatever, it is critical. It's the #1 issue in my district right now. And I think that everything that we've talked about here today just points out the importance of it.
Right, and if you want to access the state's website, that's kind of difficult if internet is sketchy in rural areas, right, Ray?
Certainly a valid point. And to Senator Yaw's point, I would suggest that Senator Yaw, I will bring that up at the Opioid Command Center about how important broadband access is in our rural areas here in the Commonwealth to issues like assuring that we have the connectivity for group chats, Zoom links, other telemedicine initiatives. The previous speaker, Steve, did a great job really outlining some of the things that are working as we live in these very unusual times. And at the same time as I congratulate him on his recovery journey, I understand that it's those initiatives that are going to be making the difference as we move forward.
Ray, what challenges does the state face in dealing with an epidemic and a pandemic at the same time? It sounds overwhelming.
Well, first, I did want to reassure you that the Department of Health is well prepared to manage several health epidemics or health crises at the same time. We have emergency preparedness and response experts. And in regard specifically to our opioid crisis, obviously we know some of the challenges that have been laid out here today. But I want to make it clear that our efforts are still laser focused in regard to the opioid crisis. And whether it's assuring we have enough naloxone out there, assuring we have the right people at the table to discuss the issues, or even making sure that our robust PDMP stays robust, these are the initiatives that we're staying focused on because these are the initiatives that have worked up until this point. As we move forward, we definitely need to expand some of those efforts. And to Senator Yaw's point in regard to the broadband access, that's clearly an area that's working. And I don't want anybody to think that our efforts are flagging. The Wolf administration still has a focus on our overdose crisis here in PA.
And even if your internet is sketchy, there still is the 1-800 number, the hotline that people can call to talk to someone about either how to get through recovery or help them with the issue at that very moment. So can you tell us, Ray, about the advantages of the 1-800 hotline?
First, let me reiterate, it's 1-800-662-HELP. It is staffed 24 hours a day. And to date, they've had tens of thousands of calls, and at least half of those callers have been connected directly to a treatment provider. That is one of the biggest successes of this administration in regard to our collective fight on the opioid crisis. Anybody who needs help, again, reach out. That line is always staffed, and people are there to listen to what you have to say, to address your concerns, and to get you to the right resources.
Senator, in this pandemic, is it important to maybe address the factors that made people reliant on opioids and fentanyl in the first place?
Oh, I don't think there's any question. I mean, as the Secretary pointed out, I think we had things going along pretty well, and all of a sudden we get hit with this COVID-19 pandemic, which kind of derailed the train, and I think that we need to get back on track now to look at the factors, counseling. We need to look at medication-assisted treatment, all the things that were pointed out in the governor's declaration. We need to go back and focus on those things again, and put our attention in that. We can't overlook those basic things in counseling and interaction with groups of people that have experience in these areas. That's critical.
But how is this pandemic going to change these strategies in the future? The fact that people are isolated, they can't be social. There's the unknown. We don't know when this is all going to end. There's issues with isolation and dealing with the stress of your job and homeschooling. I mean, these are all triggers. So what can people do to just better cope as we try to get the train back on course?
The only thing I can think of, and we keep going back to this, is having access to counseling. And whether it's electronic counseling, phone, or in person, I think that we need to encourage people. The Secretary also mentioned about the stigma. We need to work on stigma. I mean, that's always been an issue, and we need to say, if you need help, that doesn't make you a lesser person just because you need help. And we need to get rid of that stigma, and I think that maybe that's the key.
Yeah, what do you say to people who are even questioning why we're even doing this program because we're in the middle of a pandemic? But you're saying this is still an important issue that we have to continue to highlight.
It's out there, and as we talked about, I think I looked up some information. Since 2000, there have been 450,000 Americans died of a drug overdose. That's a considerable problem, in my opinion, and it's something that we need to address.
Yeah, because there's this fear of relapse because we're in isolation.
Some of the guests have spoken about. And any of these triggers, anything could trigger a relapse or to go back, whether it's a job or a personal relationship or any of those things. And, people are very fragile, and we need to have the tools out there to help them.
Mm-hmm. And what about offering more Medicaid help? Only a third of patients who are suffering from substance use disorder are covered by Medicaid. Is there a way to increase that?
We probably could. Those are some of the things that we could look at. I think that I know that the administration supports medication-assisted treatment. I have been an advocate of medication-assisted treatment since it first was talked about. I emphasize assisted. It is not a solution. I think that some of those issues are not state issues. They're actually federal issues with the way that doctors are required to be trained in order to prescribe Suboxone, which I think is, I don't understand it. I think that we should have medication-assisted treatment should be at the family doctor level. They're the people that deal with everybody on a regular basis. They're the people who are the most likely to recognize a problem.
Let's recap that. Not all doctors are authorized to prescribe Suboxone, which is medication to help people who are substance.
That's correct. There's a very low percentage of people that actually go through the special training that's required, and then the majority of the doctors just say, no, I'm not going to do it. And then under the federal regulations, even a doctor that is has the ability to prescribe Suboxone, they're limited with the number of patients that they can have. The irony of it is that somebody can prescribe opioids without any special training, but you can't treat the opioid problem unless you have special training.
Sounds like an oxymoron. What do you think about that, Ray?
I'm very happy that the senator pointed out those federal restrictions. And, You got that. In addition, I think we are also a big fan of medication-assisted treatment, and we've seen, and I'm glad that the Senator emphasized the word assisted. That was very good as well. I will point out that through our Department of Human Services here at the state, we do have 45 centers of excellence, which actually focus on coordinating evidence-based treatment for people with opioid use disorder who are covered by Medicaid. But you are correct. This is an area where getting the number of people covered by Medicaid is a number we could probably bump up.
Senator, any closing remarks regarding the opioid epidemic?
Yes, I really appreciate your efforts in the Battling Opioids programs. As I said right at the beginning, we need to keep this issue at the forefront. It is there. It hasn't gone away. It may have been somewhat glazed over by the COVID-19, but I think it's critical. We have people dying of drug overdoses every day. And it's been going on now for 25 years or more, and I think that we need to keep it to the forefront and pay attention to it.
Do you think new treatment would be wise? And what would that be?
I have no idea what the new treatment is, but anything that's out there, whether it's a new medication or anything, new counseling techniques or whatever, I think that we can't afford not to pay attention to it. When you have 450,000 people who have died in the last 20-some years, that's a major issue.
70,000 died of drug overdoses back in 2017. That number dropped 2.9% by 2018. But now with this pandemic, the fear is that there could just be a lot of people relapsing because we're under isolation, more anxiety, more stress.
I did want to point out that in 2019, we had about 4,348 Pennsylvanians lose their lives due to a drug-related overdose. Although that number is too many, the data does tell us that we are on the right track and we're making progress. From 2017 to 2019, we've seen a 19% decrease in fatal overdoses. And that's important to remember well.
So Ray, do you have any closing remarks regarding the level of stress that people have to deal with nowadays between the pandemic and the opioid epidemic?
We share your fears as well. We have heard anecdotally of our numbers going back up. We have some preliminary information that our numbers are coming back up a little bit in regard to overdoses. This is the time we double down. This is the time we start paying even more attention, like Senator Yaw said, in regard to these issues, and then even taking it to the next step. So whether that's in regard to telemedicine initiatives or other initiatives, we do meet all the time about this, and for good reason. This is not coming to an end soon, and we need to address it or keep addressing it.
What people sometimes forget, that it could be your next door neighbor, it could be your best friend, a family member, and that it does really claim lives.
No one, no age group, no ethnic group, but no one is exempt.
But there is the recovery hotline, 1-800-662-HELP, that people can access 24/7, and you can actually talk to a human. So I would like to thank our guests for being part of tonight's program and for advocating treatment. It's our goal for those suffering from addiction to use the information provided tonight to seek help for themselves or for someone they love. Please visit battlingopioids.org. On behalf of Pennsylvania PBS, I'm Paula Giacomo. Thank you for watching.
It doesn't take long to become addicted to opioids. In fact, 10 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%, and we've opened 4 outpatient addiction treatment centers across the state to help patients recover from addiction. Learn more at geisinger.org/recovery.
Additional support provided by the Commonwealth of Pennsylvania and viewers like you. Thank you.